Hello friends, do you know that there are nearly 300 million people worldwide who suffer from autoimmune disorders? More than mortality, it is the morbidity that matters. What are these autoimmune disorders? How do they make the lives miserable? How are they diagnosed? Does the cure exist for them? And why should all of us know about them? Let us find out in next 10 minutes. This is Dr. Namkishore, and I always come out with the videos of common people's interest. If you haven't subscribed to my channel as yet, please do it, for it's only your interest which prompts me to come out with better videos. At the core of the immune system is the ability of your body to tell the difference between self and non-self, what is yours and what is not yours. A flaw can make the body unable to tell the difference between self and non-self. When this happens, the body makes autoantibodies that attack normal cells by mistake. And at the same time, typical cells called regulatory T cells fail to do their job of keeping the immune system in line. The result is a misdirected and misguided attack on your own body. This causes the damage we know as autoimmune disease. The body parts that are affected depends on the type of autoimmune disease. What do? There are more than 100 known types. Nearly 4% of the world's population is affected by one of more than 100 different autoimmune diseases, the most common of which include type 1 diabetes, multiple sclerosis, rheumatoid arthritis, SLE commonly called as lupus, Crohn's disease, ulcerative colitis, psoriasis and scleroderma, and incidence is rising. In developed countries where children are exposed to less infections and less bacteria, there are higher rates of allergies and autoimmune diseases. With decreased infections, there are decreased microbial exposures. How do they affect us? An autoimmune disorder may result in destruction of the body tissue, abnormal growth of an organ, or changes in the organ function. An autoimmune disorder may affect one or more organ or tissue types. Areas often affected by autoimmune disorder, they include blood vessels, connective tissues, endocrine glands as pancreas or thyroid, joints, muscles, red blood cells, and skin. Nothing has changed genetically during the past 30 years. Factors related to lifestyle or the environment may be involved in autoimmune disease. There could be inherited predisposition in many cases. A viral or bacterial infection may trigger an autoimmune disease. This finding suggests that maternal autoimmune disorders present in women around the time of pregnancy are unlikely to contribute significantly to autism risk. Autoimmune disease can affect anyone, yet certain people are at greater risk, including women of childbearing age. More women than men have autoimmune diseases, which often start during their childbearing years. People with family history. Some autoimmune diseases run in families, such as lupus and multiple sclerosis. It is also common for different types of autoimmune disease to affect different members of a single family. Inheriting certain genes can make it more likely to get an autoimmune disease, but a combination of genes and other factors may trigger the disease to start. People who are around certain things in the environment, like certain events or environmental exposures, may cause some autoimmune diseases or make them worse. Sunlight, chemicals called as solvents, the viral and bacterial infections are linked to many autoimmune diseases. People of certain races or ethnic backgrounds, some autoimmune diseases are more common or affect certain group of people more severely. For instance, type 1 diabetes is more common in white people, lupus is most severe in African Americans and Hispanic people. Coming to a diagnosis, an anti-nuclear antibody, commonly called as ANA, is an immunofluorescent assay. It is a first-line screening test for a patient with a suspected autoimmune disease. This test is considered the gold standard because of its high sensitivity compared to other assays. A blood is taken for ANA. If it is negative, you are less likely to have lupus. If it is positive, mostly you have lupus. If it is negative, then you have to go to tier 3 and tier 2 and tier 3 to diagnose different kinds of autoimmune disorders. Let us come to the different types of autoimmune disorders. Type 1 diabetes. Type 1 diabetes is an autoimmune condition in which the pancreas produces little or no insulin. It typically appears in adolescence. Symptoms include increased thirst, frequent urination, hunger, fatigue and blurred vision. A person having type 1 diabetes might get thyroid disorders, celiac disease, Addison's disease. Multiple sclerosis, commonly called as MS. Nerve damage disrupts communication between the brain and the body. Multiple sclerosis causes different symptoms including vision loss, pain, fatigue, impaired coordination. The symptoms, severity and duration can vary from person to person. Some people may be symptom free for most of their lives, while others can have severe chronic symptoms that never go away. Coming to rheumatoid arthritis, one can get tender, warm and swollen joints, joint stiffness that is usually worse in the morning and after inactivity. There could be fatigue, fever, loss of appetite. Early rheumatoid arthritis tends to affect your smaller joints first, particularly the joints that attack your fingers to your hands and toes to your feet. Apart from these, rheumatoid arthritis also affects skin, eyes, lungs, heart, kidneys, salivary glands, nerve tissues, bone marrow, blood vessels. Coming to SLE, systemic lupus erythematosus, commonly called as lupus, it can affect the joints, skin, kidneys, blood vessels, brain, heart and lungs. Symptoms can vary and can change over time. Common symptoms include severe fatigue, joint pains, joint swelling, headache, a rash on the cheeks and nose, which is commonly called as butterfly rash, hair loss, anemia, blood clotting problems. Raynaud's phenomenon, in which fingers turn white or blue and there is tingling when cold. Crohn's disease and ulcerative colitis. Ulcerative colitis is limited to colon, while Crohn's disease can occur anywhere between mouth and the anus. In Crohn's disease, there are healthy parts of the intestine mixed in between the inflamed areas. Ulcerative colitis, on the other hand, is continuous inflammation of the colon. Psoriasis. It's a skin disease that causes red, itchy, scaly patches, most commonly on the knees, elbows, trunk and scalp. It goes through cycles, flaring for a few weeks or months and then going into remission. Scleroderma. Scleroderma is a long-lasting disease that affects your skin, connective tissues and internal organs. Body makes too much of proteins, collagen, an important part of your skin. As a result, your skin gets thick and tight and scars can form on your lungs and kidneys. Coming to the treatment of autoimmune disorders. First of all, underline this, there is no cure, but they can be nicely managed to reduce the misery. There are various types of drugs used to treat autoimmune diseases. The type of medicine one needs depends on severity of your symptoms. Treatment can relieve your symptoms. One can use over-the-counter meds for mild symptoms like aspirin, ibuprofen, diclofenac. Severe symptoms may need prescription drugs to help relieve symptoms such as pain, swelling, depression, anxiety, sleep problems, fatigue or rashes. To replace the vital substances the body can no longer make on its own, like in type 1 diabetes, one has to give insulin. Insulin injections are needed to regulate blood sugar. In Hashimoto's thyroiditis, thyroid hormone replacement restores thyroid hormone levels. To suppress the immune system, some drugs can suppress immune system. These drugs can help control the disease process and preserve organ function. For example, these drugs are used to control inflammation in affected kidneys in people with SLE to keep the kidneys properly functioning. Medicines used to suppress inflammation include chemotherapy given in lower doses. Drugs used in patients who have had an organ transplant to protect against rejection. A class of drugs called anti-TNF medication block inflammations in some form of autoimmune arthritis and psoriasis. In many autoimmune diseases, symptoms can go into remission with the proper medicinal therapy. Disease-modifying agents include etanercept, belimumab and infliximab. These drugs are effective at stopping inflammation and damage it causes in certain autoimmune diseases such as rheumatoid arthritis. Most of these drugs have side effects, the risk of infection increases with use of any drugs that suppresses the immune system. Newer treatments for autoimmune disease are always in the pipeline. Though most autoimmune diseases do not go away, you can treat your symptoms and learn to manage your disease so you can enjoy life. It's important though to see a doctor who specializes in these type of disorders. Follow your treatment plan so that you can have a healthy lifestyle. Flares or exacerbations are the sudden and severe onset of symptoms. Certain triggers such as stress or being out in the sun cause your symptoms to flare. Try to identify your triggers, follow your treatment plans, and regularly visit your physician. Please do not try any magical cure that you might have heard from any one of your well-wishers, for the simple reason that there exists no magical cure. Thanks for watching the video.